Long-term outcome of partial oral treatment of endocarditis. Definition: infectum endocarditis is infection of the endocardium, usually by bacterium, most often Streptococcus or Staphylococcus or fungi. It can cause fever, heart murmurs, petechias, anemia, embolic pneumonia, and endocardial vegetation. Vegetation may be caused valvular incompetence or restriction, myocardial abscess or mycotic aneurysm. Diagnostic requires isolation of the microorganisms in the blood and, in general, echography. Treatment consists of the antibiotic for a long time and sometimes surgery.
Infective endocarditis is infection of the endocardium, the inner lining of heart chambers and the covering of heart valves. Infection is caused by microorganisms, mainly bacteria, that have managed to enter the bloodstream. Except for rare cases caused by massive blood infections or highly virulent organisms, a healthy heart is usually resistant to infection. This is because bacteria do not easily adhere to the surface of an intact endocardium. Constant flow of blood.
Application in medicine. Application in medicine. Infection endocarditis is confirmed when organisms are in defect on the histologic examination of the or a sample of the endocardium vegetation obtained during cardiac surgery, embolectomy, or the autopsy. Since it's not usually possible to obtain vegetation for the examination, several clinical criteria have been developed to establish a diagnostic.
The pathogenesis of infective endocarditis begins with damaged heart valves from congenital heart disease, rheumatic fever, IV drug abuse, and the placement of intracardiac devices such as implantable defibrillators and pacemakers. Valve damage leads to sterile deposits of platelets, red blood cells, white blood cells, and fibrin called non-bacterial thrombotic endocarditis, or NBTE. If a sufficiently virulent organism is present in the bloodstream in sufficient amounts, it may colonize the damaged valve and its associated NBTE, and now the mass of bacteria and the NBTE.
Pros and cons. Pros. Cons. Infection endocarditis can involve slow and subcutaneous or in a more acute and fulminant way, which is associated with a high risk of the rapid decompensation. Injuries to the right heart chambers typically produce septic pulmonary emboli, which can lead to pulmonary infarction, pneumonia, or MPM. Pros. After initially treatment patient with the penicillin substitute, endocarditis usually feel better and the fever usually subside in the 3 to the 7 days. Treatment with antibiotic can be effective, but in certain cases an operation is necessary. UCI applied in Ecuador. Treatment consists of antibiotics for a long period of time. Surgery may be necessary in the presence of the medical complication or resist organisms. Typical antibiotics are given intravenously since the duration of the antibiotic therapy must between 2 and 8 weeks. Outpatient treatment is usually continued intravenously. Conclusion: infected endocarditis continues to be a challenge to health professionals involved in the care of the patient with the condition. It's not a specific clinical characteristic. The almost constant change in the paleomics aspect and its infection cause, which puts it at the mercy of the manifestation of these microbes with their attributes and aggressive. They make the care of this disease complex and require the great effort of the responsible medical team. Thank you so much for watching the video.